Follicular lymphoma 3B is the most rare among the subtypes of follicular lymphoma, accounting for about 5 to 10% of overall diagnosis. Half of the follicular lymphoma 3B also co-express diffuse large B-cell lymphoma, but rarely co-express follicular lymphoma 1 to 3A. The most recent advances suggest that follicular lymphoma 3B has a clinical and biological behavior similar to the aggressive diffuse large B-cell lymphoma rather than follicular lymphoma 1 to 3A. Therefore, is treated with the immunochemotherapy such as R-CHOP in a similar manner to the diffuse large B-cell lymphoma. Nevertheless, the current literature is also conflicting since some studies reported a survival of about 54%, while others report a survival of 70 to 95%, suggesting more an indolent behavior. Additionally, controversy is about the presence or absence of diffuse large B-cell lymphoma in the tissue biopsy, if it can make any difference in the clinical behavior. Therefore, we decided to perform a pooled study of two multi-center prognostic cohorts called MER and LEO American study cohorts, and to investigate newly diagnosed follicular lymphoma 3B and compared to follicular lymphoma 1 to 2, follicular lymphoma 3A and DLBCL, all of whom were treated with R-CHOP chemotherapy within 6 months of diagnosis. What we found is that having or not diffuse large B-cell lymphoma in follicular lymphoma 3B did not make a significant difference in clinical characteristics of outcome. Additionally, we then compare the pooled follicular lymphoma 3B with the lower grade follicular lymphoma, and we found that FL1 to 2 relapse more frequently and also relapse more frequently within 24 months from diagnosis compared to follicular lymphoma 3B and 3A. Nevertheless, the follicular lymphoma 3B that did fail event-free survival 24 had a threefold likelihood to die of disease compared to the other follicular lymphoma, and also had to rate more probability to transform toward an aggressive lymphoma. We also compared follicular lymphoma 3B to diffuse large B-cell lymphoma subcharacterized in cell of origin of germinal center or non-GCB, and we found that FL3B was more similar to non-GCB to GCB rather than non-GCB. We then concluded that follicular lymphoma 3B with or without DLBCL has similar clinical and outcome characteristics, and while the most part of follicular lymphoma 3B behave as lower grade FL1 to 3A, 18% has a more aggressive behavior and is more similar to diffuse large B-cell lymphoma.